Hi everybody, it's David Porter, and today I have a few thoughts on CBT, Cognitive Behavioral Therapy. Cognitive Behavioral Therapy is a form of psychotherapy which is based on the Greek philosophy of Stoicism, which is about regulating your emotions. One method is by managing your expectations. Cognitive behavioral therapy is a very structured method of psychotherapy. It is very pragmatic and real time. Does not place too much emphasis on early childhood or adolescent experiences. It de-emphasizes our developmental years and focuses more on the here and now. Excuse me. Cognitive behavioral therapy can be summarized as follows. Here's a classic example. You have two men, Harry and Larry, on opposite sides of town. And there is a blizzard coming. A blizzard has been forecast. And Harry starts wringing his hands and pacing the floor and worrying about how he's going to get to work because he is, first, he's chronically late all the time anyways, and he's been warned, you show up for work again late, you're fired. And he drives a vehicle, with a two-wheel drive vehicle, and the tires aren't very good, and he is thinking catastrophically. He is catastrophizing, as CBT says. I'm not going to be able to make it to work on time. I'm going to get fired. I'm going to wipe out. I'm going to go off the road. I'm going to crash my car. I'm going to get hurt. I'm going to get killed. I'm going to hurt somebody else. I'm going to wreck my car. I can't afford to get it repaired or buy a new car. And he's getting himself very, very worked up. And so far, nothing's even happened yet. Consider that. Nothing's even happened yet. What he's experiencing is called anticipatory anxiety. Now, on the other side of town, we have Larry. Larry listens to the weather forecast, sees the weather forecast, and that there's a blizzard on the way, and he is ecstatic and bouncing up and down with excitement and anticipation because he is an avid skier. He has season passes and a four-wheel drive vehicle, and if there's heavy snow, he's not going to have work. His work will be canceled anyways. So he is getting very excited about the possibility of an awesome ski trip. So here we have it. We have two men, opposite sides of town, and the external situation is the same. There's a blizzard coming. However, they are both looking at it from a very different point of view. One point of view results in anxiety. The other point of view is in excited anticipation. Now, you may not always have the excited anticipation, and actually, when it comes to managing anxiety, cognitive behavioral therapy is more about producing a state of indifference. You are in a situation which has been fear-provoking and stressful, anxiety-provoking. Initially, the goal is to transition from a state of fear and anxiety and gradually dial that back. Use a rating scale, what's called the SUD scale, Subjective Unit of Discomfort Scale. Give it an arbitrary rating. It's subjective. It's your scale, no one else's. Of 1 to 10, where 1 is you are relaxed and at peace. Number 10, you are having a panic attack. So you rate your anxiety on a scale of 1 to 10, and hopefully with repeated trials, cognitive behavioral therapy does not just work suddenly. It can take weeks, it can take months of repeated trials, and you're going to see the progress. You could track your progress on an Excel spreadsheet because you're going to see your anxiety levels, experience your anxiety levels going down from a 10 to a 9 to an 8, and pretty soon it's going to be a 2 or 3. It's just going to be a little bit of discomfort, not feeling completely out of control. And ideally, you go off the scale. where you become not just relaxed, not just bold in the face of a fear-producing situation where you can control your fear and manage it, and not just relaxed in this situation, but genuinely indifferent. You don't even think about it. It doesn't even occur to you. That nice state of indifference is the ultimate goal of cognitive behavioral therapy. But for that matter, if you can dial back your anxiety from a level 10 down to a level 5, if you can cut it in half, you're going to be able to function. You're going to be able to do it. You're not going to dig it, but you're going to be able to do it. That right there is a huge improvement. And hopefully over time, every repeated trial, every encounter with that fear-producing, discomfort-inducing stimuli is going to it's going to give you increased confidence. It's going to make you braver. So that is cognitive behavioral therapy, and it's not just used for anxiety. It works very well. There's a huge body of empirical evidence for the efficacy of cognitive behavioral therapy. Huge body of empirical evidence going back decades, at least 50 years, probably more than that. And it works very well. It's considered the gold standard for anxiety. It works great for depression, for resolution of specific phobias, for PTSD, for OCD, for anger, for addiction, for sleep disorders. The list goes on and on. It is a very effective means of psychotherapy. And what is really happening when you see a psychotherapist who does cognitive behavioral therapy, what they're really doing is they're teaching you to give yourself therapy. They're teaching you to heal yourself. Okay, so those are some thoughts on cognitive behavioral therapy. And watch for a video. I want to go back to Harry and Larry and pick apart their background a little bit more, and introduce a concept that I call getting out of the chair. All right, everyone, thank you for watching. Please hit subscribe and be safe.